This is part 2 of treating unipolar depression. So we're looking at procedural steps for patient treatment. So the steps we should take when thinking about what a patient might need to treat their depression. So the first step might be looking at the easier medications first, so the SSRIs. So Prozac, Celexa, Zoloft as some examples. These do have fewer side effects. You always start at a low dose and move up slowly to a therapeutic dose to determine if it works for the person. If the symptoms of depression remit, mean go away, the therapist should continue with psychotherapy and not increase the medication. Wait 4 to 5 weeks to determine if the medication is working. So they do take up to 6 weeks to really notice an effect on the depression. So don't stop the medication, but it can take quite a while for it to start to work. Step 2, if the person only has partial response, only a little bit of symptom reduction in the depression to the SSRI, even with an increase in the dose, another medication either needs to be added or changed to a different medication that targets a different neurotransmitter, so maybe not an SSRI. Step 3, if the person also has psychotic features with depression, a neuroleptic of antipsychotic, so an addition of an antipsychotic might be if Step 4, if several medications have been tried, the therapist should check with the person if they are using alcohol or other substances, if they're taking the medication as directed, not taking the medication at all, which is always a possibility, and or taking an unreported dietary supplement. So they might be taking St. John's wort or something else. Step 5, we're keeping in mind that certain medications are counterindicated for certain types of patients. So certain, like we talked about, so patients with the eating disorder, so avoiding medications that decrease appetite because that can cause more issues. For patients who are overweight, avoid medications that increase weight or appetite. For patients who have a history of seizures, avoid bupropion because it lowers seizure threshold. Nafazodone may also cause liver failure in some patients, and do not mix MAOIs with other antidepressants. So if they're already on an MAOI, do not add anything else. We also have to make sure we're educating the people we're working with around depression and medication and other types of treatment. So we're looking at, as the therapist, should be doing the 5 following. The first one is that antidepressants take time to work. They do take a while, like I said, up to 6 weeks sometimes. Inform of the side effects. So all seem to start with the letter S, so sexual, sedation, seizure, and stomach-related symptoms. Side effects are usually minimal and disappear within days, especially stomach, sedation, and we need to suggest ways to address the side effects because yes, there are side effects, yes, they do go away, but we do need to manage them. So for example, dry mouth, drink more water, chew gum, never stop the medication abruptly. So you could have something like a discontinuation syndrome, so similar to a withdrawal. It could look like the flu, so it's not very nice to stop medication just all of a sudden. If the medication is to be stopped, this should be done in consultation with a doctor, so it should be tapered appropriately and wean the person off. And we need to watch for an increase in depression or suicidal ideation if we're tapering down the medication, because that can always be a factor. The fourth thing, pregnant people should try to avoid medication if possible. We should only consider antidepressants only if the patient is severely depressed and is not functioning without them. So we have to look at the pros and cons, the risk and benefits of taking the medication while pregnant compared to any risks there might be. So SSRIs and bupropion are the safest of the antidepressants for its impact on the fetus. Lithium and antipsychotic medication should be avoided if possible. And breastfeeding mothers should consult a physician always as to what types of medications pass through the breast milk or not. And that's also the website Mother Risk is a good resource for that kind of information. And the fifth is patients may resist the recommendation to take medication. Some people don't want to take medication. For severely depressed people, therapists must help the person see that medication may be very important for their treatment. So somebody who's severely depressed, sometimes medication is what can start the person's ability to do other types of treatment. So for example, therapy. They might be too depressed and may need medication in order to at least help with some of the symptoms in order to work through some of the reasons that might be causing the depression.